Assalamu alaikum everyone. My name is Rosia Ahmad Adam, an indigenous of Kano, and then presently living in Kano. I'm a nurse, I'm a midwife, and then a content creator. The main purpose or reason of opening this account is to help educate females, or to help educate women about their health condition, how to tackle it, the prevention, and then to know any dangerous sign related to condition related to your health condition. As a nurse and then as an health educator, I know we have different condition that mostly affect females' health. The first condition that will be discussed is infection. Infection is currently the most serious condition that usually affects female health, and then also sometimes affects their normal life, affect their fertility, and then their health in general. Now, the first condition that will be discussed is urinary tract infection, also known as UTI. First, what is the meaning of urinary tract infection? Urinary tract infection is a condition that affects all the urinary tract in general. It is a condition in which a bacteria enter into the urinary system. It affects the kidneys, the bladders, and then also the urethra. In general, it affects the urinary system. Then, how to know or how you can identify if you have this kind of a disease or infection, or we can say the signs and symptoms, like what you will know, and then like what will make you to know that you start having this sign of this condition. First, you can have like abdominal pain, like plank pain. Plank pain means like to be having a pain in between your like back pain, sideways. You can be having that pain, painful urination. Sometimes you have blood in the urine, which is called hematuria, and then sometimes we'll be having fever, having frequent micturition, scanty micturition, painful urination, back pain, lower abdominal pain, like I said before. All these symptoms or all these signs are signs of urinary tract infection. The urinary tract infection mostly affects female due to the shape of their reproductive organs. So it mostly affects female. Though it affects men also, but it mostly affects female. And then after someone start having all this kind of symptoms, like you have this frequent micturition, you have this lower abdominal pain, flank pain, which is back pain, you have all this kind, you have to visit nearest hospital or center. In that center, they will make an investigation for you, mostly urinalysis and ultrasound scan. And in urinalysis, they will check for the bacteria, like which kind of microorganism present in the urine, and then they will check for the protein, they will check for the sugar level. They will also make ultrasound to know the position of the kidneys, activities of the kidneys, if the kidneys were normal, if the bladder is normal, or that bladder is having any kind of inflammation. After the investigation, the doctor will review the results, and then he will recommend some medication for you. If there is any kind of abnormalities in the urinary tract organs, like maybe to say if there is any abnormality in the kidneys, then maybe the doctor will refer you to a consultant. That consultant will check if you need any further assistance, and then he will recommend everything for you, and he will also check the result. He will also check that result.